Sheriff Ozzie Knezovich talks with community leaders about issues in the public safety arena, sponsored by River Ridge Hardware.
This is Sheriff Ozzie Knezovich with the Sheriff's Report. Today in the studio with me, I have Dr. David O'Brien with Multicare. We're going to talk about what we're facing with the pandemic here locally, the efforts that are being made to get the community through this. I really appreciate the time that you're taking to come and talk to people. I really think it's important that we have that frank, candid discussion with the public so they understand, you know, this is what we're facing. This is truly the dynamic that we're seeing, and the patients levels that you're seeing. So with that in mind, would you mind just kind of introduce yourself, give
Sure.
people an idea of who you are and what you do for the community?
Well, thank you, Sheriff, and thank you very much for inviting me to join you this morning. I really appreciate the chance to sit and talk about this important subject. I am Dr. David O'Brien. I am the Chief Executive for Multicare here in the Inland Northwest region. So I'm responsible for Valley Hospital, Deaconess Hospital, and Rockwood Clinic. And my background is in medicine my whole career. I practiced family medicine for many years before I went into administrative and leadership work. And so it's really a privilege and an honor to work with really fantastic leaders at both hospitals and at Rockwood as we take on this major pandemic issues. And I also wanted to thank you not only for inviting me this morning, but to thank you and your whole department for your amazing commitment and work to care for our community. We share a similar mission in that regard.
Well, thank you. Can you give us an idea of what it's like inside the walls of the facilities that you're in charge of, and you know, what your staff are facing right now? What's it like for Multicare right now?
Yeah. Well, maybe just to set a little context, 6 weeks or so ago, we had 6 or 7 COVID patients in the hospital. Today, we're in the 70s and 80s. It's been an amazing spike in the increase in volume due to the Delta variant being very infectious. We have, really the hospital is very stressed right now. Our hospitals have had to open up COVID wards that are dedicated to caring for just COVID patients. We've had to, our ICUs are full of COVID patients. The ER is seeing record volumes of patients. Many of them are COVID. One of the interesting statistics and worrisome statistics is of the 60 to 70 patients we have in the hospital today, over 90% of them have not been vaccinated. So we're seeing a big flood of COVID patients in individuals that have not been vaccinated. But to your question about what is it like in the hospital, our doctors are working very, very hard. Our nursing staff and support staff are working extremely hard. It's very much a challenge because COVID patients get sick. If you're sick enough to be in the hospital, that means you need oxygen and you need intravenous therapy. And in the intensive care unit, it means you need either ventilatory support or other ways to try to help keep yourself oxygenated. This disease really deprives people of oxygen, and that's one of the main reasons to be in the hospitals, is to support that. I think one of the biggest challenges for our staff in the hospital, to get a feel for it, is that there is a lot of suffering. There is a lot of death. And our medical professionals, we're sort of hardwired to help people get better. I mean, that's what we're about. We're about taking patients that need our help and getting them well. And this virus is very hard to treat, and it's very hard to get people well, and we're seeing more deaths than we've ever seen. And it's very hard on the staff, psychologically, emotionally, and I worry about how that is impacting our staff. So it's a very tough environment, very stressful. I'm very proud of our staff and our doctors, nurses, and support staff. They tirelessly get up every morning and come in or work all night long, and are dedicated to taking care of all of our patients, our COVID patients and our non-COVID patients, because non-COVID disease continues and we still have those patients to take care of.
You mentioned the non-COVID patients. We're coming into flu season.
Yeah.
Some reports that I've been reading, this could be a very challenging flu season. The last time we had a challenging flu season a couple of years ago, we faced very similar challenges on our medical infrastructure. Now you add that and COVID on top of it. Are you concerned about this year's flu season?
I'm very concerned about the flu season. Healthcare, hospital care has some ebbs and flows. In a typical year pre-COVID, we would be always very busy in the wintertime with flu, increase in patients because it's winter, people are indoors, flu's a lot like COVID, very contagious. And then in the summer, we tend to have a little decrease in volumes in the hospital, and then it peaks. Well, we're not even in winter yet, and we're already full with COVID patients, and the flu season is going to get started. So by the way, I encourage everyone to get your flu vaccine as well as your COVID vaccine. So we are concerned that we're going to start seeing the normal spike in volume for flu on top of the already high volumes we're having with COVID. The interesting thing is last winter when we were really in lockdown and people were staying home and wearing masks and not going places, we had a very light flu season. So the things that transmit the flu are the same things that transmit COVID. It's a cough, a sneeze, something like that transmits the particles through your saliva that get aerosolized or droplet particles. So yeah, we're concerned about the flu season.
The Delta variant. The Delta variant has kind of changed the game a little for us.
Mm-hmm.
The older population at the beginning of the pandemic was considered very, very high risk. But we're now seeing a change in demographics. We're seeing the Delta virus starting to affect younger and younger people, to include children. Many reports, many studies I've seen, we're talking young children, not teenagers, we're talking 5, 6, 7, and younger even at times. What are we seeing here locally as far as the effect on our kids?
Well, the under 12 is the population we do not have currently have a vaccine for, although Pfizer the last couple of days has announced it has research that indicates they have a safe dosage for younger children, and that's going through the process, and hopefully that Pfizer vaccine will be available for children in the near future. But you're correct. Earlier in the pandemic, when the vaccine became available, many of our 50, 60, 70, and 80-year-olds flocked in. We were doing 1,000 vaccination doses a day up at Deaconess back then. And so we've really done a good job vaccinating our older population. That demand has not been the same for the younger demographics. So we're starting to see, as I mentioned, of these 90+% people in the hospital with COVID, they're largely in the younger age group, not in the older age group. I would refer you to the Providence Children's Hospital here for some specifics, because we don't have inpatient care for children, but But I'm hearing reports that they're seeing increased volumes of children admitted into the hospital with COVID, and that's very worrisome. Especially now that schools have started, and you know how kids are, they're not real good at hand hygiene and things that would kind of reduce the transmission. So very, very concerned about that.
You've mentioned the vaccine several times, both the flu vaccine, the COVID vaccine. There's a resistance out there to the vaccine. In my opinion, that resistance was created when we made a political football out of this pandemic. And if there's one thing I hope the future leaders of this country learned from this is never politicize a pandemic. This should have been a time that we locked hands together and devoted our attention to fighting the true enemy, which is this disease that is killing people. You know, that said, what's your advice? Because there's there's controversy here, there, and everything about, well, look how rapidly it was produced. Well, yeah, it was rapidly produced based on the technology that we've had for the last 40 years of creating these type of vaccines. And this has been one of the largest mass trials in the history of the world.
Right.
So we rapidly found side effects and everything else. What's your advice? How would you, if I wasn't vaccinated, and I am vaccinated, how would you try to convince me to get vaccinated?
Well, the science says that the vaccine is safe and it is extremely effective. And I mean, that's really what it all boils down to. It's safe and it's effective. People should not hesitate to get it as soon as they can if they're not vaccinated. Vaccine science in this country is the most advanced in the world, and we should be celebrating that we were able to produce this vaccine in such a short period of time, not being suspicious of it. It's a testament to the incredible advancements in medicine and in science and in pharmacology that we're able to produce at this level, this vaccine that is so effective and so safe. To me, it's short of miraculous. I'm very proud of our scientists and the capacity of our nation to be able to do this. Vaccine science goes back to Pasteur days. I mean, it's decades, centuries old, and it's become very, very advanced. So I would encourage people to understand the science and do what the science tells you to do. This is not a time to be thinking about, be suspicious of your healthcare providers. I would encourage people to go talk to your doctor and get your questions answered. Your doctor knows the most about you and your particular situation, whether you have other illnesses and things of that nature, and the importance of you getting vaccinated.
I have to agree with you as far as the pride we should see coming, especially from this nation, in that if you take a look at the moonshot, that was a phenomenal feat. What was done with this vaccine in months rivals that great accomplishment. And it was a partnership. People forget that all those people, companies that produced this vaccine actually got together. They shared details, they shared the ideas. Something that rarely happens, because let's face it, they're in business. Proprietary knowledge and everything else. But they actually dropped all of that. They dropped that, and they said, what is the best for the people, quite frankly, of not just this nation, but the world? How do we counter this deadly disease. And they did. They did it very rapidly. Our leadership in government gave a vision and said, let's do this as quickly as possible to save as many lives as possible. And I guess that's the part that really I struggle with, in that now we have this debate about, and quite frankly, it's not divided on political lines. There are people on both the left and right that will not get this vaccine because of the politics behind it. And I've received that phone call from my daughter last November when she came down with COVID.
Wow.
And Dad, they're talking about putting me on a ventilator.
Scary.
And that was a very long night. Myself, I came down with COVID last January, and took all the precautions possible, but still came down with COVID. It was 90 days before I could get the vaccine. After it finally came out, because I had been COVID positive. One of the things you always hear is, well, if I had COVID, I have to have the antibodies. Why do I need the vaccine?
Yeah, well, the science indicates that you will mount an immune response if you get a native disease, if you catch it. But it's not as robust. And interestingly, it's not as robust as the immune response that you'll get from the vaccine. So we really encourage people, even if you've had COVID, after a period of time, you should go ahead and get the vaccine series to fully vaccinate yourself to further protect you. You know, the rapidity with which this was developed is based on years and years of science that had already been built and created. It's not like we just started from scratch and say, hey, we need a vaccine. We know how to make vaccines. Right. We just now know how to make one that really is specific to this virus.
You and I have been working on this issue pretty much nonstop since last fall, really, because we pulled everybody together. Got ready for the second spike that was predicted in January, February, and standard crisis of care is one of the big topics that we talked about. Now, can you explain to folks what that entails and why that is really, when we hit that level, the system is really at jeopardy at that point? Because you hear it in the news, you hear it, but I don't think people really understand what that level means.
Well, in healthcare and in medicine, we have this concept of a standard of care. So you have a heart attack patient, you want to take care of that patient according to a certain standard, and that standard is well understood among medical professionals. Crisis standards of care means that pretty much goes out the window. And you invoke crisis standard of care when you do not have enough resources to take care of everybody that comes to your facility. And it's often, right now, it's really not a function of the building, it's a function of staff. We can't admit a patient in the hospital if we have a doctor, a nurse, respiratory therapist, pharmacist, support staff, all the teamwork it takes to take care of a patient. When that gets overwhelmed, you reach a point where somebody has to make a decision who's going to get what resources you have and who's not going to get those resources. Our colleagues, unfortunately in Idaho, are in crisis standard of care today, and they're making these kinds of decisions. We are stressed in Spokane area. We're not in crisis right at standard of care at this point, but Sheriff, it really wouldn't take too much to tip us over. So we're very concerned about never wanting to put our doctors and nurses in a position of saying, I'm sorry, we can't care for you. That's probably the most traumatic thing a healthcare professional could ever say to somebody is, I'm sorry, I can't take care of you, because we go to school and we dedicate our lives to caring for other people. We always have our patient's best interest at heart. But to be into that kind of a situation, and then it's really hard for us to figure this out, because there is a way to prevent it by taking the vaccine. And if everyone who's eligible would take the vaccine, we wouldn't even be having this conversation right now. We'd be, you know, out having coffee and having a good time. So that's really kind of like the sort of the agonizing piece that I think our providers have to struggle with.
I can tell you that if things were slightly different, we wouldn't be facing what we currently are facing. And your and I, night's sleep might be a little bit better, because this topic does keep you awake at times. You talked about the crisis standard of care. The implications of that are elective surgeries, and maybe not so elective surgeries, in my opinion, because you really have to weigh, you know, can that cancer patient that has the tumor in their lung wait long enough before it spreads to the brain, so we can get through this crisis. That has to be a very difficult decision for a doctor to make.
Yeah. Thank you for pointing that out. That's very challenging. We have suspended elective surgical procedures and only doing emergencies, because we have taken all of our staff in the operating rooms and redeployed them out onto the medical floors to take care of medical patients that are inundating our hospital. And in fact, our surgeons have said, hey, we can help. They're actually helping round on medical patients. And so there's a lot of our resources being devoted away from elective surgeries and preventive medicine procedures. And that's exactly where what you're saying is, we worry, is somebody's disease going to progress during this suspension of these procedures? Is somebody's preventative test going to not pick up a cancer early like it could if we could be able to manage that more aggressively and earlier? So we're concerned that we will see more disease later in the year than we would have if we weren't having to do this. But you know, that's one of the things we have to do in order to take care of the person who's standing there in front of you and can't breathe. I mean, we just have to take care of them as like more of an emergency.
A lot of people, because of the stress that's been placed on the medical system right now, could you give some maybe guidance on when I should go to the ER, when I should maybe go to urgent care, or when I should maybe just see my doc and get treatment that way? Because I think a lot of people are kind of confused, and I've actually heard people go, "Wow, I don't want to clog the ER up, so I'm not going to go." But they waited that touch too long, and I've actually seen people die.
Yeah, we saw this earlier in the pandemic when we were first starting to get all of this figured out and people were afraid to go to the hospital. The first most important thing is, if you're having chest pain, symptoms of a stroke, or some, you know, medical emergency, you should go to the ER. I would implore you to go to the ER. We will find a way to get those emergencies taken care of. We don't want people sitting home with a heart attack for 2 or 3 days. Most of these kinds of illnesses, these kind of events, have a short window where you can do an intervention, and you want to do that early on, not 2 days later when we can't do anything for you. But if you have a minor ailment, you know, it's you're worried you sprained or fractured or sprained your ankle, or you know, you have a skin infection or something not that serious, that's where the urgent care can come in. And if for other things, you should always rely on I'm a family doctor, so I'm a strong believer that the first point of contact should always be your family doctor or whoever's on call for them to get your medical advice. But don't stay home with serious symptoms. Come and let us get it checked out.
We have about 3 minutes left. I'm going to turn that 3 minutes over to you to cover anything that you think needs to be covered that we didn't necessarily touch on, because we really do need people to sit back, drop all the rhetoric, drop all the Facebook, social media, anger and hate that I see out there. And folks, there are people that are exploiting this for political means, and I find it probably one of the most disgusting things I've seen in my political career is to watch people hold rallies and give false information. That is tantamount to evil in my opinion. But 3 minutes, what would you tell people?
Well, I'll speak to you as a physician. Healthcare is a calling for us. We go into healthcare to help other people. Years and years of training, decades of training in some cases. Our patients trust us when they're having their babies. They trust us when they're having a heart attack or a stroke. They trust us to take care of their cancers. I mean, we take care of our patients from birth to death. And we do that always with what's the best interest for our patients. And so I would ask people to avoid, be careful where you get your information. There's a lot of misinformation out there. And please consult your healthcare professionals and providers who have dedicated their lives to caring for you and would never give you advice to take a vaccine that's going to hurt you or to do something that's going to hurt you. Our whole profession is dedicated to caring for people. Universally, healthcare professionals will tell you, get the vaccine. It's the best hope for yourself, your children, your family, your community, and ultimately it's the best hope for the whole world. And that's what I'd ask you to do, is come and ask a healthcare professional or a public health official that has also dedicated, their whole life is dedicated toward taking care of the public. I think that would be my greatest plea, is to get good information, make a good decision that works for you, and let's get this pandemic under control so we can get back to normal life.
I'd have to echo that. Folks, I was talking with my wife the other day, and she said, well, okay, what's up? Because she said, very quiet at home. And I said, well, it's because of what I'm seeing and how we change this dynamic. And she said, and how to convince people to get a vaccine that's going to potentially save their lives. And she said, well, why did you get a vaccine? And I went, well, and she said, no, tell me why you got the vaccine. I went, okay, well, I looked at it as a duty to get the vaccine so I could stay in the saddle doing the job that these people elected me to do. Very much the reason I took the vaccines when I was in the military, when they sent me overseas. That, and I trust my medical profession. I trust the leaders that brought this to us. And I look at this as one of the greatest accomplishments that, as a nation, that we've done that's been totally overlooked. And she said, well, why don't you tell people that then?
Yeah, that's great.
The wisdom of wives.
Yeah.
And I look at it that way. Folks, Dr. O'Brien is spot on. What we accomplished as a nation together gave us a vaccine that can stop this pandemic and give us a sense of normalcy back. COVID's going to be around for a long time now. It's all how we learn to deal with it and how we learn to manage it.
Right.
We've been given the tools to manage it. let's take those tools, use them, and take pride in what we accomplished as a nation. This is Sheriff Ozzie Knezovich with the Sheriff's Report. Have a great day.
Hi, at River Ridge Hardware on the corner of Garland and Driscoll, 2803 West Garland, with a wheelbarrow full of deals. I have antifreeze for all your summer toys. Keep them running for next year, $3.99. I got rakes for all those leaves that are coming down, $7.97. And from plastic to the metal rakes, same price, $7.97. I have 2 different shovels to pick from, both $7.97. Come on down, get those shovels now while they last. Also, bird feed for the winter to keep those birds nice and fat for the spring, $14.97 for a 40-pound bag of bird seed. We also are selling good bird feeders that keep the squirrels out and to choose from. And not to mention, the wheelbarrow's on sale too for $79.97. Come on down. Now, all of our greenery that we have out here now is still 30% off. Get it while it lasts. Not to mention the yard art is 20% off. Good time to start shopping for Christmas for your mom. Get that yard art, put it in your closet, bring it out during Christmas. She'll love you for it. Come on by at River Ridge Hardware, corner of Garland and Driscoll, 509-328-0915, or shop us online at riverridgehardware.com.
Thanks for watching. Ask the host a question, recommend a guest, or check out any of our other programs on Facebook, YouTube, Twitter, Apple Podcasts, Spotify, or SpokaneTalksMedia.com. Sponsored by River Ridge Hardware.